Hi, I'm Jodi, your host, and I'm really excited to share my guest today, Isaac Elias. He's a leading expert in the field of integrative medicine, specializing in cancer, detoxification, immunity, and complex conditions. He is a respected physician, researcher, best-selling author, educator, and mind-body practitioner. Dr. Elias partners with leading research institutions, including Harvard, National Institutes of Health, Columbia, my alma mater, and others to co-author studies on integrative therapies for cancer, heavy metal toxicity, and others. He's the founder and medical director of, help me pronounce the name of your clinic,
Amitabha.
Amitabha, which I'm sure will ask you the meaning of that name, in Santa Rosa, California, where he filters blood.
Aphorism.
Thank
Therapeutic
you.
aphorism.
And treatment for detox and chronic degenerative conditions. Welcome.
Thank you, Jodi, and I'm very glad to be on this podcast. Was looking forward to it.
Well, no, and it sounds like you bring a variety of experience and knowledge to kind of helping with chronic illness. So, do you want to just explain what is the survival paradox?
Yeah, well, the Survivor Paradox is a book that I just wrote in September of 2021 that reflects my decades of studies as a clinician, being a medical doctor and being a licensed acupuncturist. So really studying both worlds in a deep way. The decades of practice in meditation was focused on healing and being an active researcher. And it really offers a new paradigm. It's really a paradigm shift in how we think about our health and diseases. We are very aware in integrative holistic medicine, and now medicine is more aware because of COVID, that inflammation drives every chronic disease. But inflammation is really the vehicle that causes it. It's really not the cause. What causes inflammation is our inappropriate survival drive. And that's the paradox. The paradox, Jodi, is that we are built to survive as beings, as societies, as the earth, as everything tries to survive. And it goes all the way to our cellular level. And our response to survival is actually what causes us to get sick and shortens our life. And that's the profundity of the paradox. Because when we respond with survival, when we respond with the survival reactivity, we first do it through the autonomic nervous system, through the sympathetic system. And the response is very automated. That's why it's autonomic nervous system. And it's done through either fighting, right, which equates to inflammation,
Right.
or through flight, where we go away and we hide, which create fibrosis. And these processes are very, very basic to every chronic disease. And we either respond with inflammation or we respond with fibrosis. And the ultimate example of this is what happens to a cell who doesn't want to die, who wants to survive. It doesn't recognize that it's part of a whole community where it comes into life, it expresses itself, and then it goes into apoptosis and another cell will come. Just like us, we come to this world, we live our lives, and life comes to an end. And when these cells decide it wants to survive, it creates a microenvironment. It creates a different coating, a different area around it. It hides from the immune system. It becomes autonomous and it starts growing on its own, and we call it cancer. And then it creates inflammation as part of being aggressive, and it spreads. And eventually it kills the host and it kills itself. So that's an example how cancer is driven by inappropriate survival response, inappropriate immune response. That's what happened with the COVID. We get an inappropriate survival-driven immune response with the cytokine storm. And then we get all the side effects, and that's what people really get sick from and die. And so this is why it's very basic. And then, of course, is what can we do about it? How can we move
All right. Before
from
we get into what we can do, I want to kind of land on that for a minute. Because what I think I hear you saying is that we have a survival impulse, autonomic nervous system, fight or flight or rest and digest. We get stuck in sympathetic. We become sympathetic dominant. And then it's almost like our cells become a runaway train where they're not collaborating with our system, but they're kind of surviving on their own. And that's when problems set in. Did I get that right?
Yeah, that's one part of it. So I talked about the nervous system. What happened after a few minutes, So the nervous system, we go into sympathetic mode, right? And then we take a deep breath, we relax, and we can go into parasympathetic back.
Right.
Less we have too much of a sympathetic, but what happened? We get a biochemical response.
When we're in sympathetic, it's kind of like the domino cascade.
Yes, but
Okay.
that's one part. You got your biochemical response.
Right.
Biochemical response the body does by using something called alarming survival proteins, with the
Right.
leading one being galectin-3, which I've been researching for decades. And when galectin-3 comes into play, it drives all the cytokine and inflammatory cascade. It drives this damaging process, but it's not easy to turn off like the autonomic nervous system.
Well, I see what you're saying. So there's the autonomic nervous system, which triggers the survival protein, and all of these things need to be downregulated in order for people to heal. But once they're it's like the fire that becomes the wildfire that's hard to kill.
Exactly.
Okay.
It's like a waterfall cascade
Right.
where we in medicine try to deal with the water at the bottom. So, interleukin-6, cytokines, it's too late.
Right.
Start with galectin-3 at the top. So when you blow galectin-3, and then what I do from a biochemical perspective, it's my work with PectaSol, with modified cytospectin. It blocks galectin-3. So if you look at the research on modified cytospectin, you will find research on kidney disease and health, on heart, on liver, on
Yeah.
neuroinflammation, on cancer, on detoxification, on heavy
Yeah.
metals. Why? Because it's fundamental movement that causes health issues in so many levels. So we're really addressing the issue at the root. But the biochemistry is one aspect, and the other aspect is what we can do with our lifestyle, with the way we think, with the way we live our life, with the way we process life.
Right. And just so the listeners to kind of chunk it down a little bit so that it's easier for them to understand. We're talking about kind of when your nervous system, which is part of it, gets stuck in the wrong gear. That's when you're in survival, everything not critical to survival downregulates. And it also turns on this protein. And before we get into the solutions, I really want to kind of hover on what's going on so people can identify and maybe hear themselves in this. So this can then turn into, cancer, you mentioned, heavy metal toxicity, detoxification problems, digestive problems. What are some of the other symptoms that, as a collective, we ascribe that could have this as the foundational root?
Because it's so foundational to our being, and
Yeah.
it drives inflammation and fibrosis, it will affect every health condition. If you look at the condition for galectin-3 in a chart, you will practically see the research on the about 10,000 published paper on galectin-3, you'll see every single condition. But the classical one is what inflammation causes. So it affects immune dysregulation, autoimmunity, heart disease, cardiovascular, circulatory diseases, metabolic diseases. We move from normal metabolism to survival metabolism, from normal mitochondrial function. Normal cellular function, you produce energy in a slow way, but in an efficient way, right? One glucose produces 36 ATP.
Hmm.
Don't have a toxic byproduct. The cell
Hmm.
doing well. When we go into survival mode, we produce energy through glycolysis 100 times as fast. We are in survival, but very inefficient. Only 2 ATPs for one glucose. A lot of byproducts, lactic acid, a damaging compound. So naturally, it will affect every organ. So chronic kidney disease, acute kidney injury, lung disease, heart disease, neuroinflammation is a very big one.
Yeah, it's interesting. I used to run marathons and, I knew my speed and sometimes I'd run faster and I could keep pace with the faster person for 2 miles and then it would kill me. So it's basically what you're kind of saying. Like
Right,
if you're running at high capacity, you're not supposed to stay there and these damaging effects happen.
right, right.
Now let's kind of land on your solution. And before we kind of get into PectaSol, it's a binder. It's made from is it apricot pits or what is it?
I mean, PectaSol is modified citrus pectin.
Yeah.
It's a pectin is the white inside part of it's extracted from the citrus fruit, but it's modified in a very specific way to a low molecular weight. So it gets absorbed into the bloodstream, and there it has its effect. So the main effect is blocking of galectin-3. So it regulates this unhealthy process and has effect on so many aspects. And then it also has additional benefits as a binder, which are
Right.
different.
Especially for lead. It's a great
Right,
bind.
excellent for lead and for mercury, for cadmium, for all the positively charged. We published on its ability to bind to even uranium, and it can bind cesium, and but it can also bind some mycotoxins. And so it's a very good binder, but it's beyond the binder. Why do I say it's beyond the binder? And some people know it as a binder. Use it.
Yeah.
Some people use it for immunity because it regulates immunity. It's more than a binder because a binder can bind toxins.
Right.
Modified cytospectin regulates and downregulates the inflammatory response. So you don't get the side effects of binding. It actually regulates the damaging process that is caused by toxins. And that its uniqueness. I mean, it can be used with binder, it can be used with supplement, it can be used with medications, it can be used, with essential oil, it can be used with anything, because
Right.
what it does, to understand what it does, we have to understand how galectin-3 works. What galectin-3 does, what is a survival protein? It gets a message that something is going wrong. It goes to the damaged tissue, and it's really the bus driver, and it drives different inflammatory compound, growth for a compound, hyperviscosity compound, is part of the repair system. We're trying to repair. How do we repair? Through inflammation. Just like, Jodi, when you get cut in the skin, right? You end up having a scar. The scar is a repair system, but if you get scars internally, you get organ dysfunction. So the galectin-3 comes to the tissue, and then it creates a pentamer, and the pentamers attach to each other, and it creates a coating, a biofilm. For example, biofilm, the basic structure is galectin-3. So it creates this microenvironment where under the microenvironment, suddenly you don't have enough oxygen. You have a different environment biochemically that makes the cells, the tissue, function in an abnormal way. So when you break this lattice formation, you allow the body to heal in a much healthier way. And that's why it's such a foundational supplement, in my opinion, after being in this for decades. It's the most important supplement someone can take because it will, as we age, galectin-3 levels go up in the blood, and it really what causes inflammation. Inflammation is driven by galectin-3.
So I kind of land on something. So what you're saying is it's a biofilm disruptor, which is complicated. I mean,
Yes, oh, of course,
yeah.
is because biofilm, the basic structure, you've got galectin-3, and then you got the oxidized lipid and the heavy metals attaching to the galectin-3.
Right.
And then the biofilm creates a microenvironment, right? It's a different environment. So yes, so the PectaSol disrupts the biofilm, but it regulates the modified cytospectin because it disrupts galectin-3. It downregulates the unhealthy inflammatory response, and that's why it's such a universal solution, and that's why people can feel that their memory is getting better, their joint feel better, their circulation is better, their blood pressure is improving. How is it possible? Because we are addressing a fundamental process of aging and damage to the body that is a result of this abnormal survival response. And that's a paradox.
I love it. And I know you have people take high doses. It's like 6 tablets twice a day, correct?
Yes, so the dosing depends. For people who just do maintenance, who are, young, like under 40 and healthy, they can take 6 capsules a day or 1 scoop. People who are dealing with serious illnesses, they take 6 capsules 3 times a day or 9 capsules twice a day. In our clinical trials on modified cytospectin, for example, in prostate cancer,
Uh-huh.
so we on biochemical relapse of prostate cancer, we get a really encouraging results with slowdown of the PSA rise in 80% of the patient in a multi-center trial. People took 18 capsules a day. So you have the maintenance dose of 6 a day, but if you are dealing with health challenges, you will go to the full dose of modified cytospectin, which is 15 grams a day. It's a very sophisticated fiber. because it's a modified fiber that gets absorbed into the bloodstream. But it's as close to nature as you can be. It's really made from the citrus fruit.
Yeah. And so I'm curious, do you do that just in isolation or do you have other people, do you have them like focusing on other remedies and supplements as well? Is it a
Oh
one
no,
and done magic bullet or
no, no, no! It's definitely not a magic bullet
okay.
because it addresses a foundational issue. It
Right.
lends itself to be integrated with other treatments. So we published research. There are 80 published papers on our modified citrospectin. And there are papers on modified citrospectin being synergistic, for example, in cancer with chemotherapy, with radiation therapy. So you can combine modified citrospectin with anything. That's the beauty of it. It
Right.
lends itself to being combined with other substances. It has a remarkable safety. It's really safe for everybody. Yeah, so that's what makes it so special.
It's a nice binder for kids too because it's kind of gentle. And
Right,
one thing that we've noticed, we have an essential oil that you put on the vagus nerve to kind of stimulate the parasympathetic nervous system. And what we've found is that it then, if people have been stuck in survival for a while, they have a lot of delayed maintenance. And all of a sudden, they start kind of draining toxins and, their lymph might be congested or the fascia might be clenching or they might be reabsorbing the toxins. So we're really trying to make sure that the body is set up to let the garbage leave and
right.
not
Yes,
reassimilate.
right. Yeah, that's important. Yeah, it's a concept of elimination. You can't discharge,
Yeah.
you don't eliminate from the organ to the bloodstream and to the gut. Yeah. So yeah, it's very, very important. Absolutely.
Interesting. And is there anything else, do you want to kind of elaborate on how you help patients deal with the survival paradox beyond?
Yeah, of course. So, in my training, it's multi-dimensional. So, in my personal medical practice, I use multiple tools. If it's acupuncture, if it's healing, hands work, meditation, injections, and neural therapy, because survival causes scars. And
Yes.
scars can be multi-generational, as we know from research that people from the Holocaust, their offsprings carry the traumas. And in my book, The Survival Paradox, the book is truly a paradigm shift book, especially for health providers, but also for patients. People who read it, it really changes their whole way of thinking about their health. So in the book, towards the end, when I talk about solutions, when I explain what is survival paradox, how it affects our body, and I go through every major system in the body and cancer, and I give a lot of clinical examples of stories. Then I talk about solution, which are detoxification, healing our scars of survival, and then I talk about healing the mind, letting go of the survival response. So in the healing of our scars of survival, I tell my own story. I'm named after my grandfather, and certain symptoms I had since childhood that really were epigenetically passed from him. And when I healed them in a dramatic way, I had always had this chest pressure, and then just a few years ago, it totally disappeared. 50 years after it started, my mother, who could never see any movies or documentaries on the Holocaust, was suddenly able to do it without talking to me. Because I went back and I healed my trauma with my grandfather, which then affected my mother as the first generation. So
Yeah.
that's the power of healing. There are different methods. In the thing that I specialize in, which I'm known as a disruptor on a global level, is the use of therapeutic apheresis for inflammatory condition. And what is therapeutic apheresis?
Wait, before you move away from epigenetic and like family, constantly, what tools do you like to heal kind of multi-generational trauma? Like I played with family constellations, played with emotion code. Like, what have you tried and what do you like?
Yeah, so there are different tools we have to deal. Family constellation is very important. I specifically use some unique meditation techniques,
Talk about
methods,
that.
some which are based on my decades of practice in Buddhism.
Yeah.
Then a certain insight that I had in how to relate them to our physiology. So if we look at our physiology is built Jodi, to heal from such traumas. What do I mean? When we are reactive from our ego, from our head. Something happens to us and we react. And this reactivity, as we mentioned, goes down every cell, right? So if you look at every cell in our body, every organ, it takes nourishment in, clean blood, clean nourishment, and it lets go of toxins, what it doesn't want. It happens all the way to the membrane level of the cell that lets go. There is one organ that functions differently. There's one organ that accepts everything other organs don't want, with an open, embraced heart. It's called the heart. The heart gets all the dirty blood from everywhere. It doesn't say, I'm going to take only from the liver. I'm not going to take from the kidneys. It gets it from everywhere.
Right.
What does it do? It connects to the universe through the breath, through the lungs. And our drama for the universe, it's not a big deal. The universe is reflected in infinite time. No, always past, present, future, and infinite space. And then we get clean oxygen that comes to the heart. And what does the heart do? The heart gives blood in an unconditional way. The aorta, the main artery that comes out of the heart, is a rigid artery. It doesn't contract in any way. It gives blood everywhere. And the first organ that the heart nourishes is the heart itself, through the coronary artery. And that's reflected in the heart nourishes itself in order to nourish others, so it can do it work, and as part of nourishing others. And the heart is the exemplified selfless giving, because it always gives. But in order to give clean blood, it has to take dirty blood. So we have to take our traumas, our difficulties, and instead of fighting them, we transform them. We use them as wood to the fire. And another amazing thing about the heart, and observation that I made, and also worthwhile knowing, is that the heart is the only organ that nourishes itself after it finishes doing its work. It finishes, the heart could have gotten blood in the right atrium when it started, the blood just came in, or in the left atrium would be better, it's clean. Yeah, of course. But no, the heart nourishes itself only once it puts the blood out. And that's the concept of self-love. It's part of loving others.
So
It's part of loving compassion.
are listening to this and they're like, I suspect I have epigenetic trauma. I'm not quite sure how to transmute it. What is your practice something that's heart-centered? Is it breath-centered? How do you work with people who have epigenetic intergenerational trauma that they're not sure how to,
My practice is heart-centered. It's called, when I teach meditation and healing in the clinic, I have a lot of tools.
Right.
Of course, and that's why I mentioned therapeutic aphoresis, because it's filtration of the blood outside the body, similar to
Is
the
that like you have a needle in one arm and another? Like that's
Yes, exactly. It's similar to dialysis, but it's a very fancy procedure. But it's the same concept. You see how you can have technology and you can have simpler. Yeah, so I call my approach open heart medicine, the infinite healing power of love and compassion. It's going to be my second book. It's going to be
I love that.
And it's based on decades of training, insight, and clinical application. And so everything is centered around it. And when you connect to the heart in a true way, you move from effortful trying and survival to a letting go process, effortless. And within it, of course, breath needs to be, because what is breath? Breath is movement. Breath is life. When we stop breathing, right? In Judaism, neshama. Neshama is soul. Neshima is breath. And the only difference is there is a yud, there is the letter of God, the divine energy. So when we stop breathing, we lose the connection, right? But what happens when the heart stops moving, we're dead. So to be alive, we think and we go back and we go forward and we get stuck and we get fixated. So fixation is in the nature of our daily life through our head. Movement and flow is what our heart does. And the beauty of it, Jodi, we are built to do this, So when you connect to heart-based practices and you learn them in hours, they affect you in a day or two. When you try to change your mind thinking and your thought process, that's hard work, right? Because why? We are trying to overcome our very fundamental survival drives and reactivity. We're trying to move from reactivity to heartfelt compassion and compassion expressed responsiveness, where we get the stuff that triggers us, but instead of reacting with fighting, we respond with compassion. And the beauty of it, again, is that we are built to do it. And that's why it's so profound. And so when you have this kind of thinking, small tools can go a long way. And if you look at your field of essential oils, why are essential oils so powerful? Because the smell in them goes very deep into the organs. It goes very deep into our essence. And it can really open things in a very deep way. In Chinese medicine, there's a discussion about the taste and the smell having as a vehicle to penetrate deep into the qualities of our organs. And this has a physiological effect, actually have a psychological effect, and it also has a spiritual effect, which is a little bit too complicated to explain in a podcast. So the idea, when you embrace a profound model and you understand that because everything is changeable, as long as we don't get stuck in a survival mode, everything is possible, then small things can go a long way. But if you need a dramatic thing like therapeutic aphoresis, it's there for people who come to the clinic. And so that's the beauty of it. When you look at people who have a health provider practitioners, and they need to use a lot of tools and a lot of method and a lot of machinery, they missed the essence of understanding. So we are trying to compensate with a lot of fancy treatments. But when we go back to the basis,
Yeah.
anything and everything is possible. And that's why one of my favorite saying is, not everyone will be a miracle, but anyone can be a miracle. And the reason is because everything is changeable.
Okay, so speaking of that, for people who are listening who are like, I would like to learn more about his heart meditation and how to work with him. Is that something they have to come see you in the clinic? Can they do that virtual? How does one do that?
So in the last decade, I've focused on teaching in Israel. I have a foundation there, and I've taught thousands of people on a volunteer basis. And now with my book here, I'm going to shift my focus to the US. So in 2023, I'm going to start offering these retreats.
Okay.
And the first retreat, initially will be in Zoom. I'm actually going to make it as an offering.
Maybe where?
I'm going to do a first retreat will be a few days on Zoom. So it's,
Oh, Zoom. Okay. Oh, so it will be virtual. That's what
yeah,
I was wondering, because all of these people, there's certain things that are easy. If you're deficient in vitamin D, pretty easy to supplement,
right.
If you need to exercise, you can figure that out. But if you have, if you're the child of a Holocaust survival, if you have ancestral trauma, that's a tricky one. Oils do help, but that's like a bigger nut to crack. So,
Of course, yeah. So it's time. I know it works from thousands of people that I've helped.
yeah.
And so and again, I'm bringing forth decades of training. I'm not, I wrote my first book in my early 60s, but I started.
We're tracking. How do people, where and when on Zoom
Right.
can they find this?
So, people can go to dreliaz.com
Okay.
and they can register for my newsletter, which is a high quality research driven. And then I will let them know, when the retreats come. I plan to do the first one in the spring of 2023. And my plan is to offer it as a free retreat as part of my offering. And this is really my third act, and in my 60s I started we didn't talk about my background, but I started my journey at the age 15, learning Taekwondo and meditation in Korea when my father was a civil engineer. So I'm looking at almost 50 years of meditating and contemplation. And it took me also almost 50 years, to put out the Survivor Paradox, the first book. We say in Judaism that the life and death is in the power of the tongue. And you have to be really very, very contemplative before writing a book because it has a lot of power. So I took my time, took decades. But now it's my time to share my experience and my unusual training, learning vertically different medical system, not horizontally. And so that's what I want to do. That's my joy. That's what my heart wants to do. And that's what I plan to really share. And it's interesting that while I'm coming to this from a meditation insight of decades of practice, in my research life, and again, I have a very large NIH grant to research galectin-3, actually in sepsis and acute kidney injury. And in my research life, I stumbled on the survival protein, which contracts us, which creates fibrosis, which doesn't let us open our heart. And then I came with this, biochemical natural solution, modified cytospect in PectaSol. So you can see in my own journey, I did it on a biochemical level, and I'm doing it, in the more esoteric, multidimensional level. And this integration is what I would like to offer to people. I feel it's my responsibility to do it because I spent decades refining it.
No, that's amazing. Is there anything that we haven't touched on that you'd like to share?
I think for a first podcast, it's a good start. I'm really, really happy to connect to you and with you. And if we talk again, we can take more time to explain actually the esoteric views a little bit about essential oils, how they relate to meditation, to different aspects of different organs. That's a great topic.
I
That
would love that. I would absolutely love that.
it deserves its own podcast because I have to go through a whole process of explaining how the mind works, how reality works, how our relative reality works, and what are the emotions that are related to it, and why essential oils are such a tool. And if you look, for example, in Ayurvedic medicine and Tibetan medicine, there are 5 like spiritual herbs that are very fragrant.
Yeah.
They have smells. And essential oils just deliver it in a powerful way, but I don't want to spoil it.
That sounds amazing.
Great.
Thank you so much for your time and your insight. This was fabulous.
Thank you.